Tell me when you're ready.
Other day.
Are they, the N95 ones, are they more comfortable? Or?
There's so many different types. The one I have is like, it looks terrible though. It looks like an alien. Like it comes out. Yeah.
Welcome everyone to tonight's meeting. This is the August 13 regular meeting of the Sullivan County School Board. I see you. How about now? Okay. We're going to try to speak loudly so everyone can hear us. We're going to call the meeting to order. We'll do that now. The first order of business is to approve the agenda. When we approve the agenda, we also approve the consent agenda and all the items in it. All those in favor say aye.
Aye.
All those opposed say nay. The ayes have it and so ordered. We're going to break from protocol a little bit tonight because I know we have several speakers. I'd like to welcome you. Since we do have so many, we're going to try to stick as closely as possible to our 3-minute rule. Dr. Cox has a set of cards. Green is for go. What's the other, yellow and red? Yellow, you have 1 minute left, and red, you're about out of time. Wrap it up in the next few minutes, next few seconds. So here, when you come to speak, give us your name, your address, and your topic. I'd also like to stress that I know when speakers come quite frequently, they're a little bit nervous. Don't be. We're happy to have you here, and we want to hear what you have to say. So we will begin with a student, Mandy Middlestead. Approach the podium, give us your name and your address.
Hello, my name is Skylar Middlestead. My address is 221 Regency Drive, and I am speaking for the students on going back to school. May I begin? Hello, my name is Skylar, and I'm a sophomore at Sullivan South High School. I'm someone that is going to be directly affected by the decision made here today. I would also like to add, I'm not only speaking for myself. I'm speaking for Ruby Lane, Anna Saltis, Mary Grace Dancy, Emily Weininger, Elizabeth Kaiser, Hannah Carles, Drake Liner, Desiree Ketron, Reagan Kelly, Heidi Caston, Megan Youngblood, Rachel Carmel, Sophie Weiss, and many more that I simply do not have time to list. I'm here to represent the students that do not get a chance to speak. Now, I ask that you do not take any of what I say lightly. This is coming from more than just myself. As the school board, I believe it is your job to protect us in any way you can. I also believe that's what you're trying to do with online schooling. But there's so much more to consider than only the physical health of the students here. What about their mental health? Online schooling takes away the support system that helps give many students through the day. I have been to a total of 5 online school days, and thinking about waking up tomorrow and sitting in front of a screen for 7 hours with little to no social contact sounds impossible right now. The reason for that is online schooling takes away my support system. Anything enjoyable about school has been taken away, making it much harder to get through the day. I can no longer talk to my friends during school, which is one of the main things that motivates students to go to school and to learn. I'm also a student athlete, as many of my friends are, and knowing after the day is over, I get to go play the sport I love with the people I love helps me get through the stress of school. But unfortunately, soon, I might not even have that. I have spoken to many students experiencing mental illness before writing this, so keep that in mind. Part of this comes from them. With online schooling, students can no longer escape from a bad household environment, leaving them to their troubles at home. On top of that, there are many subjects significantly harder to learn online. One of my best friends wants to become a cosmetologist, and sadly, she is not getting the education she deserves by trying to learn through a screen. For a lot of students, it is difficult to stay focused and learn without being in a classroom. A study done by the University of Washington, Seattle, and the University of Maine shows that students who do not engage in hands-on learning were 1.5 times more likely to fail a course compared to students who did. Hands-on learning engages both sides of the brain and also increased activity in sensory and motor-related areas of the brain. There's absolutely no way online school can make up for in-person school. Online school is not a long-term solution. Now, this is the part where things will get serious. Statistics. I'm sure everyone here has heard the emotional argument for returning to school, but I'm about to present undeniable proof of the negative outcomes of online schooling. Teachers are normally the leading reporters of suspected child abuse. In fact, in 2018, only 16.6% of child maltreatment reports came from non-professionals, meaning friends, neighbors, or relatives. States across the U.S. have seen reports of child abuse fall between 20 to 70%. Teachers cannot tell if a child is covered in bruises or cuts or any signs of abuse when they see a student over a camera. For children in troubled home situations, they are being forced to stay in the most dangerous place they could be. ER doctors have seen more severe cases of child abuse ever since this happened. In the first month of the pandemic, reported cases dropped by 19% in Tennessee, and that was only in a month. According to the CDC, more than 30 million children participate in the National School Lunch Program, and almost 15 million participate in the National School Breakfast Program. This is a critical source of healthy food for low-income families. Also, according to the CDC, 70 to 80% of school-aged children receive treatment for mental health in school settings. In Tennessee, the calls to the suicide hotline have increased by 800%. Texts have increased by 63%. For the first month of COVID-19, more people died from suicide than the virus itself. For many teenagers, schooling is what gives them the encouragement to keep going, so please don't take that away from them. You don't have a cure to the virus, but you can help students in need. You can save lives. Thank you.
Thank you, Scholar. Now we'll have Mandy. Please approach the podium.
Hi, I'm Mandy Middlestead. I'm Skylar's mom, representing Sullivan South, 221 Regency Drive, Kingsport. First of all, I want to say thanks to you guys for letting us to speak tonight. This has been a long time coming. We've been wanting to do that. There's a few things I want to touch on, but first off, I want to just mainly say that what has been expressed by a lot of you before. Our metrics does not need to be based on nursing homes. You are comparing a very healthy group of children, school-aged children, to an immunocompromised group of elderly people. These are not comparable measurements in any way whatsoever. I'm actually going to do in reverse of what I was going to do because I have some stats I'd like to give to you guys. But first I want to talk about the Family First Corona Response Act. I'm going to refer to it as the FFCRA, just for shortened version of this. It was passed in April. And basically what it is saying that companies have under 500 employees can apply for this. It's also actually expanded under the FMLA. And by my understanding and knowledge, behind it, a lot of the teachers now are being allowed to bring their children to school, and the children are being taught by aides and things like that. I understand the rationale of that occurring to be able to get our teachers in school to teach our children virtually and online. However, my issue is this. If they are allowed to bring their children to school with taxpayers paying for it from the state, and they're practicing social distancing, then our children should be allowed to do that. You can do that, and you have solved an issue where a lot of teachers are saying this is helping their burden for their child care issues, but what about the other 90+% of the families that have this issue? You have solved a very minute population, and I want to make it very abundantly clear that we respect our teachers and we love our teachers. However, you cannot say that it's not safe for children to be in school, then allow children to be in school and select children. I work in healthcare. I'm an essential employee. I have nurses, friends that are having to send their children to other states to live with their grandparents because they cannot provide child care and help them virtually learn. How is this fair? It's not fair. The other frustrating part is this. What I don't think people realize is that underneath this act, if every single person in here decided to go under this expansion act, do you know what that means? Our county will shut down. Our essential employees can go underneath this act, underneath FMLA, and they can request leave from their job to take care of a child who does not have child care or who does not have someone to teach them at home. Our county is shutting down as it is. We do not need to continue this type of situation. What if our nurses took this? What are we going to do? How are we going to help our people? We can't do that. I've obviously voted for face-to-face to go back to school. Luckily enough for me, I have a high school student, someone who can care for herself. But the metrics that you're using are just crazy to me. But what I wanted to tell you is there's 3 counties I want you to look up. All of my information has come from the CDC, Department of Labor, and the Tennessee Department of Health. So really quickly, one county to compare, if you want to look at Sumner, Knox, and Blount County. Sumner County, 191,283 population. We have 158,000. They did not delay learning. They went hybrid from the beginning. Elementary school starts back face-to-face this Monday. Their numbers, if you look at the website, their confirmed and probable cases are 3,449 as of Monday. Ours is 1,037. I know my time's up, sorry. But Knox County, 470,313 population. Not much bigger than our area here. Knox County delayed their opening by 1 week. They're starting on Monday, face-to-face or online virtual. I know that I'm out of time, but there's a whole bunch of other statistics that you can see that if you are going to use these metrics, you need to compare the numbers and use them properly, because these places have 4 and 5 times the numbers that we have. The voting and the surveys I don't think are actually properly, because people who want to do straight virtual online learning, these people are still voting in these surveys that you're sending out to parents. And bless them if that's what they want to do. But you need to separate the numbers and get an accurate count, because if you have 25% of the people who are already enrolled in virtual online, and those same people keep voting that way, that negates my vote, and it negates a whole bunch of other people's votes. So we just want you to look at the actual statistics and make a very educated decision on that.
Thank you. Next speaker, Christy Frazier. May have to skip her. Somebody said she's on her way. I'm going to ask everyone that approaches the mic to speak a little, get a little closer, and speak a little louder if you don't mind. Kyle Ratliff.
My name's Kyle Ratliff. I've got a 2-year-old in the Sullivan County school system. I do want to make it clear that I don't represent anyone here. I speak for myself and myself only. We do have a limited amount of time, so I'll have to rush through this just a little bit. I've heard some people say they don't envy your position here as board members because these are tough decisions to make. I say that all of you campaign for this position. You ask to be put in this position and make these tough decisions. The "but it's really hard" excuse is not something that I appreciate hearing, because our students can't do that, and their Board of Education shouldn't be allowed to either. Humor me for just a second and raise your hand if you've read the Academy of American Pediatrics Guidelines for Return to School document. Okay, just in case those of you that haven't, I brought some copies for you tonight. To summarize from that document for those who haven't, the AAP says, with obvious safeguards in place, and quote, to strongly advocate that all policy considerations for the coming school year should start with a goal of having students physically present in school, end quote. They go on to state, along with the CDC, that some of the negative impacts on school closings include social isolation, which makes it difficult to identify or address learning disabilities, difficulty identifying or addressing sexual abuse, substance abuse, depression, and suicidal ideation. The second leading cause of death in 10 to 24-year-olds is suicide in this country. It also says that there's a negative impact on food security and physical activity. They go on to say that education for the entire school community regarding these measures, the entire school community regarding these measures should begin early, ideally at least several weeks prior to the start of the school year. 8 members of this board, without significant input from teachers or parents, developed a plan that gave our educators 7 days to prepare for full virtual instruction, and our parents 7 days to prepare for childcare while they work outside the home. The CDC also states that so far in this pandemic, and I hate to compare to the flu, I've heard enough of it, fewer pediatric deaths have been reported than in each of the last 5 flu seasons. Low-income and minority students are particularly affected by school closures and out-of-classroom instruction. I can't send my son to school with his teacher and 20 students because of the inherent dangers of COVID. Instead, I sent him to a church with 100 other students and 4 teenagers to watch after him, make sure that they wash their hands, do their schoolwork, and don't kill one another before the end of the day. The YMCA is a fantastic after-school program, don't get me wrong, but they are not a school program. And by the way, their capacity is limited. The CDC also says that schools play a critical role in supporting the whole child, not just their academic achievement, end quote. I think it's important to remember the wonderful educators that we have in our area aren't just teaching 2 + 2. They're introducing Johnny to a lifelong love of books and reading. They're teaching Susie the importance of befriending the new kid or eating lunch with the girl that was bullied at recess that day. They're lending Billy an ear to talk about his drug-addicted father that spent the family's rent and grocery money on meth last month. They're giving advice to a girl who's had her heart broken, advice that may prevent her from taking her own life later. They're not just teachers, they're surrogate parents, they're therapists, they provide safe harbor for these kids no matter their age. I feel for all the educators that are here tonight and that are watching online as well. They've been given scant time to adjust. This is all new for them too. Now they're being asked to figure out how to deliver lessons to half their students in the classroom while simultaneously delivering that lesson to the other half at home. And they better hurry because the board might decide that something different will happen effective Monday. They've had to figure out how to deliver their lessons virtually and keep students engaged. They've had to, with little help from the technology employees, figure out how to take online attendance for those that can't log on until 4 p.m. They've had to take their personal vehicles to the warehouse to pick up desks and replace the student tables because the warehouse employees couldn't be bothered to deliver them. They've taken those and painted them themselves to make sure that they're fit for use, along with parents and grandparents. They're left to fend for themselves when it comes to cleaning supplies and disinfectant. Dr. Cox, you said yourself, the cleaning kits were being put together when you were asked at the last meeting. You also stated floor markings haven't been put in place yet. We've been out of school since March. Have we not known the start date of the 2020-2021 school year until recently? Why? Why were these things not done in advance? And why do the administrators leave the teachers to put down the tape, to transport and haul desks and build their own barriers for themselves and their students? I'm almost done, by the way. Why can't the maintenance department assist with these tasks? It's sure not because they've been mowing the grass or taking care of the grounds at our schools for the last 5 years. The parents and grandparents have had to take that on themselves as well, just so their kids can play on a playground without knee-high grass. And nobody on this board better have the gall to tell me that it's because of a lack of funding. None of our educators, living on far less than they deserve, by the way, decide that a lack of funding is what causes their children to not have supplies. Instead, they take what money they can spare and they go buy it out of their pockets. They're expected to do that at this point. They could take a stand and refuse to do that until the county steps up, but they know kids will suffer and they won't let that happen. So they make plexiglass dividers to separate their students. They have their husbands hang up clear shower curtains so they can take off their face shields to teach. They haul and paint desks and put down tape in the hallways. They do all this at night and on weekends because, in case you've forgotten by now, they're not software specialists, central stores coordinators, grounds maintenance, or maintenance supervisors. They're teachers, and they only have a week to make a lesson plan that may be thrown out the window by Monday. This is not a blind call to start schools back without regard for safety. I implore you to start doing the right thing today by making sure schools, educators, and students are provided with the proper PPE and cleaning supplies that they deserve. Implement the plan you copied and pasted from the Nashville Metro School District. Get the tape down, put the signs up, and for God's sake, find somebody other than the teachers to help you do that so they can focus on their lesson plan and get these kids back in school where they belong. Our educators deserve better, our parents deserve better, and our students deserve better. Thank you.
Thank you, Mr. Ratliff. Okay. All right. Everybody, we started out trying to do 3 minutes, and I told Dr. Cox, let's go to 4, because I could see that wasn't enough time. But we are going to have to stick to the 4 minutes, if that's okay. Whenever that thing goes up, I'm going to wrap it up and give whoever's talking a few seconds to wrap it up. But we extended the time a little bit because we can see that it's really not going to be possible to do it in 3 minutes. So, having said that, Missy Stogel, are you present? Approach the podium and give us your name and address and your topic, please.
Too short. My name is Missy Stogel. I live at 3312 Princeton Road in the South Zone. I'm here as a parent only. I'm going to have to leave as soon as I speak because my son has a boatload of homework, and I'm the homework parent, so I apologize for that, but I will be watching online. In early July, you released the framework 31 pages. I downloaded and printed and read every single word, and I based my decision to send my son back to face-to-face learning based on your framework, the 31 pages. I thought it was a great plan. And apparently, Kingsport City Schools and Bristol City Schools thought it was as well. Had I known you guys were going to ditch that, or have the thoughts to ditch that now and go straight into hybrid now with cases high, I would have definitely chosen virtual learning. I didn't know. I thought that's what you guys were going to stick with. Now, Virtual Learning Academy is closed, and you're not enrolling. I understand why. You just can't take new kids. I get that. You know, when you sent the survey out, you had two options, fully and hybrid. You didn't give the option of sticking with what you had. I'm not asking you to stick with necessarily what you have. I'm asking you to give it just a little more time. I'm concerned because the cases are high still. I have immune-compromised parents that help with my son every single day. I'm just concerned. I'm asking for a couple more weeks, 3 to 4 weeks. I'm not saying wait till we get back to yellow, because I think that's going to be a while. I'm just saying give it a little bit more time to see if the mask mandate is working and cases start going down. That's all I'm asking for. I've talked to teachers. I've talked to our teachers. They don't think it's safe at this point either. I know there's some that's going to speak, but the ones I've spoken to are not comfortable right now. My son's class is the largest 5th grade class in the school, 57 kids. 27 in-person learners are in his homeroom. 14 people on a hybrid schedule is a lot for that size classroom to social distance at 6 feet. It's a lot. I know you mentioned that cleaning supplies are coming. I hope they are. What happens when they run out? At Christmas, our teachers last year asked if parents could send more cleaning supplies, wipes and Lysol and paper towels. We did that. In the end of January, we were asked to send more. And by February, the shelves were empty and we couldn't send more. The shelves are still empty, and I'm worried about cleaning supplies when we do go back to school. That's a major concern. At the end of every class, the teacher, my son's teacher last year, asked every student to take one Clorox wipe and wipe their desk and their chair to take care of that. Are we going to have the cleaning supplies necessary? It didn't stop the flu, and I know we're not comparing the flu, I get that, but we've closed because of the flu. Are we going to be able to clean well enough to stop COVID? That's my question. In closing, I'm asking you to refer back to page 6, the guiding principles. Number 1, your guiding principles is you'll be transparent. You've done that, and I appreciate that. Number 2, you'll center your decisions on what is best for all students. I think you're doing that. Number 3, that you're going to listen. You've opened for comments, and I appreciate that tonight. I appreciate the opportunity to get our comments. And number 4, that you'll put safety first. You will leverage science, data, and public health leadership to inform the choices that we make. I believe in this guide, the Tennessee Department of Health and the Sullivan County Health Department worked with you on that, and I believe you've done that. And tonight, in closing, I'm asking you to stick with just that, the number 4, that you'll put safety first. Just give it a couple more weeks. Thank you.
Thank you, Missy. Next speaker is Ashley Cross. Ashley Cross. Approach the podium, give us your name and address and topic, please.
Sorry, anxiety's a little. Name's Ashley Cross. 528 Cave Hill Road, and that's in Bluntville. So, I'm not like the other moms. Nope. I've been an essential worker. I've worked the entire time. I'm not saying it's not safe out there. I did have a whole nice speech and was going to stick to it. I'm more or less going to talk from heart as a mom and the struggle and just everything in general. And I applaud this little girl. She had me in tears over there because here she's a teenager and has to deal with adult issues at a freaking teenager's age. I couldn't have handled that at her age. I can barely handle the daily life that I give now. I put on this mask, have panic attacks sitting up there. I'm a nervous wreck. Last night, I had my 5th grader, his homework out. And then my 8th grader sitting over here on this side. I had to have them leave the room so that I could have a meltdown because I can't do it. I can't do it. I can't find the time. It's not that I can't find the time. That's not even the right words. I love my children. They need that interaction. We've already took away their sports, the drive that they already have. And then you want to take away their online, or going to school, seeing friends. Some kids are old enough to give them instructions. Some aren't. I know you got little hellions out there that won't listen. Excuse my French, but there is ways to make this work. I keep my distance. I've always kept my distance before COVID happened because I don't trust people. I don't trust the board to make decisions for my kids. How am I supposed to be okay with the decisions you all make? Because I have to sit behind the screen and think, well, I'm going to work tomorrow, or am I going to feed my kids? Choices that I have to make. I will tell, Bluntville has some of the best teachers. I called one last night. She helped me keep me from jumping off the edge because that's where I was at. I'm done. I got to go, people. It's my time to go. And that's how working families feel like. I know you all deal with it. Everybody deals with it. It's not the same when both parents work. A single mom working in this time. Do we choose go to work or stay home and take care of our kid and their education? I get that. It's all scary. But I choose not to live in fear. I wasn't raised to live in fear. No virus is going to stop me from living my life. Granted, I may get it tomorrow. I hope I survive. I hope you all survive. But I can't live in fear. And that's what we're doing. We're living in fear. Don't go to school, people. You may just catch something. I'm going to catch it. Somebody's going to catch it. I can't worry about that. But I can't worry about sending my kids and worrying about them not becoming better than me. Because I'm a crappy old warehouse person. I'm not famous or got a great job. I make it do. I support my family. And that's what I do, to let them live a better life than I did. I got my Sullivan County education, and I'm not the smartest cookie in the shed. But my family is most important to me. And then there's some families in this community that doesn't have that. What about those kids? Those kids that, that parent that's over sitting there on a meth pipe or some kind of drug-induced coma. I know people like that, unfortunately. Am I proud of it? I don't do that shit. Excuse my French. But there's families like that. There's families like that. And you're letting them down. And my 15-year-old shouldn't have to worry about it. My 5th grader shouldn't have to worry about it. And they shouldn't have to be doing online and struggling as a kid. They are children. The adult issue should be my problem, not theirs.
Thank you, Ashley. Next speaker is Brian Atkins. Approach the podium, give us your name and address and topic. Thank you.
Awesome. My name is Brian Atkins, and I live at 388 Woodcrest Drive, and I represent a Rebel Nation in Sullivan South High School and my daughters. First and foremost, I want to thank all the teachers out there. They've done an amazing job in an unprecedented time. With that being said, the time is now to get our kids back to face-to-face learning. The parents who chose Virtual Academy made a fantastic decision for their family, their situation. And for us as a county to be able to pull that off in a short period of time, that was an amazing accomplishment. But the fact is, a large number of us did not choose that way for a lot of individual reasons. We've taken multiple surveys. We've seen countless delays from these meetings. Decisions that we can't allow our children to delay their education. And our results haven't changed. We want our kids back, face to face. I heard a lot of talk last meeting about COVID-19, but what I didn't hear is a lot of talk about mental health. You know, as a suicide survivor myself, what we're doing to our kids' mental health and the adults' mental health is alarming. According to Metro Nashville news article, our suicide hotlines have seen an 800% increase among calls between adults and children. 10% of our fellow Tennessee citizens are out of work. Now we're forcing parents to choose between finding a job and helping their second grader with math. You know, some parents are having to choose FMLA and take less pay, take sick time, or completely quit their job in order to provide for their kids' education. This only increases anxiety, suicide, depression, fear. You know, I work in the mental health field now, you know, counseling our kids. And what we're doing to our kids is alarming. The CDC on August 3rd, our CDC that we listen to, the reason we all have masks on, warned of significant public health consequences if we don't open them back up our schools. The majority of our kids in this county, we have a ton of them that rely on mental health and nutritional help. The decrease in child abuse cases in this county is alarming. And the fact that last meeting we talked about the majority or a lot of our Sullivan County kids, we don't even know where they're at. How we can go on with that is alarming. It's like what was said the last meeting, the gap between those that have and those that have not, it's just widening. We have to live with COVID-19. On a personal level, I have a special needs daughter, severe immune issues, severe health risk. She's been in ICU multiple times. Her life depended on a respirator from catching a common cold. I can stand here before you and say I don't fear her going back to school any more than I have the previous years. She's always has and always will be susceptible to respiratory diseases and other diseases. I actually feel better with some of the screenings and protocols we have in place to send her this year. The alarming thing is we've had one group of people who have constantly worked since day one during this pandemic, and that's been our teenagers. Our teenagers, in fact, my daughter tonight would be here with me if not for the fact she was teaching cheer and tumbling face-to-face to children. We've had teens bag our groceries, serve us our meals, give us our pals sweet tea, but we can't let them go to school. We've all been in our schools. You know, we've all allowed them to serve us, but we can't serve them. Lastly, I want to say, for 3 of these high schools, life will never be the same after this year. They're missing out on their final years of memories, their final memories that will last a lifetime. These kids deserve, and some want, the last chance to walk the halls of Raider Nation, of Cougar Country, and to hear, once a rebel, always a rebel, one last time. Open back up our schools. Our kids need it.
Thank you, Brian. The next speaker is Misty Richie. Approach the podium, give us your name and address and your topic. Thank you.
Misty Richie, 453 Fall Creek Road. I'm here in support of keeping our kids online only. I have a 4th grader at one of our elementary schools, and I'm also an instructional assistant, so I'm also at the school. And the first thing I'd like for you to do is look around. We have a mask mandate. I work with elementary schools, and we have adults not even wearing their mask. I mean, it's simple enough. If we're not wearing a mask as adults, our children from K to 5th are not going to wear a mask. We still have nose pickers. We still have kids with ADHD. How are teachers going to teach our children when all they're doing is saying, pull your mask up? It doesn't belong over your eyes. Don't touch the kid beside you. We have classrooms that are not big enough to personally separate them 6 feet apart. We just don't. And we need to really look at the statistics. And with that being said, I have talked to elementary school teachers. I have talked to middle school teachers and high school teachers. They all say the same thing. It is not safe. We have elderly people that take care of our children. We have teachers that are older that they don't have a choice. They have to work. So we're putting them at risk. They get quarantined. Are we going to get a sub? It was hard to get subs last year. Instructional assistants stepped in to be subs. It's the truth. We have buses. Our school buses go with Holston High or with Central High School. So are you going to be able to clean buses before you come pick up our children and take them home? And are you going to be able to separate them? I've been in a school bus with elementary school kids. They don't behave. They don't sit still. You're not going to keep them from touching. You're not going to keep their mask on them. It's just not going to work. And I'm not a negative person, but it's not going to work. I'm in the school. I'm in the cafeteria. I miss them. I miss all of our kids. I teach a computer class for first graders. I miss them. But I know these kids, and they're not going to keep their mask on, especially when they're not doing it at home. And with that being said, my son is also a cancer survivor. He is a childhood cancer survivor. And we have chose virtual for him, but I choose to continue to work and to help support our family. But with him being a childhood cancer survivor, it's not fun when one of your friends dies. We have been to more children's funerals with a disease we cannot protect our kids from than we can with COVID. We have the materials to protect our kids, and that's at home. If parents choose to do sports, congratulations, that's wonderful. But then you're putting our kids at risk when they come to school from being at a football game. So with that being said, I appreciate each of you, but we do have a mandate, and our school is amazing. Indian Springs is amazing. Our teachers are amazing. They're over the negativity. They're doing the best they can. And I tell you, our 4th grade teachers is what my child's grade is right now. I don't sit beside Jacob doing virtual because I don't sit in the classroom with him. And as a parent, we have to teach them responsibility. And it starts in kindergarten. So we teach them how to log on, and then we move away. And if they have questions, that's what their teachers are there for. We don't sit with them in the classroom as parents. So I ask you, as an educator, and for all of my educating friends, to please consider to keep our kids online for their safety. Thank you.
Thank you, Mitzi. Next speaker, Christy Frazier.
Hello, and thank you guys so much for putting this together for us. We really do appreciate this. I think I need to start off by saying that this is not easy for any of us, no matter what role we play in our community, whether it just be parents or teachers. This is very difficult for us all. I think that we have to first acknowledge the extreme consequences of not returning to school. I will not list them all, as several have, but instead I will mention to you some keywords: neglect, abuse, hunger. Sullivan County has 1,500 kids on IEPs. Greater than 50% of those students are on free and reduced lunch. 165 of our kids do not have access to internet. Let me repeat those first 3 words: neglect, abuse, hunger. Now that we have acknowledged the cost of opening, I hope we all can agree that this virus must be downright lethal to anyone that can justify to simply ignore, neglect, abuse, and hunger. This is where we must all stop, reevaluate, and seek the truth. From the Tennessee.gov website, the Tennessee death rate across the state is 1%. Children under 20, 0%. For Sullivan County, of all our entire population, 0.009% have succumbed to COVID. Nationwide, 1/5 of 1%, 1/5 of 1% in the ages of 0 to 19 have tested positive at the time of death. You hear a lot of talk, well, if I were on that board, I wouldn't open that school. I wouldn't want the responsibility of the first child's death. I hope we are aware of the increase in the depression rate nationwide. Suicide is the leading cause of death in the United States for 10 to 34-year-olds, second only to accidents. Consider that. I wouldn't want to be responsible for that. The reasoning for not opening on the board was they simply couldn't ignore the numbers. What numbers are we looking at? Where are we getting these numbers? Ballard gives data based on their region. Their region covers 21 counties, totaling 1.2 million people. It is the size of New Jersey. Please be responsible when you're evaluating data, and don't let that merger affect my child's education. I would like to mention a banner that hung at Rock Springs Elementary School for the senior parade. It read, "Congrats, seniors, you've made history." We are all making history right now. What will we be known for? To the teachers that do not want to go back to work, is this your COVID legacy? Go back to the 3 words. Be honest. Be honest with yourself, truthfully. Evaluate. Are we enjoying our vacations over the summer? Did we just simply return from Florida to join the boast in speeches against returning and opening schools? You are responsible for our nation's future. I can think of nothing more essential. What I would like to see is a new metric system, opening up with our current one would never be possible. It is a metric set for closure. Please consider our population density. Choose an indicator besides only positive PCRs. Choose a threshold that can allow for adjustments, sure, if our mortality rate is affected. We must be able to factor in what actually is the risk of a positive case. That's all we hear. Positive case, positive case, positive case. What was the result of the positive case? Remember, an asymptomatic positive without an increase in hospitalizations means we are building herd immunity. That is a good thing. To the parents whose children test positive, I would urge you to retest. We can look to the governors of Texas and Ohio and even locally at our nursing homes. Both tested positive, retested the next day to receive negative results. Board members, please acknowledge the importance of extracurricular activities for our youth. I hear so much talk about how hard this is mentally on us as adults. As adults, the first thing that should cross our mind is not how hard it is on us, but how hard is it on our children. We all have a responsibility, collectively and individually, to pull each other through this. We are making history. We can make this work if we have truly and honestly one common goal: our children, our future.
Thank you, Christy.
Thank you.
Next speaker, Michelle Estes.
I'm going to read part of a letter that was written by myself Dr. Michelle Estes, along with Drs. Kimberly Hunt, and my name is Michelle Estes, sorry, broken protocol, 521 Lakewood Road in Kingsport. Pediatricians and I wrote this letter on behalf of the kids we see, a lot of kids in Sullivan County, Kingsport, Southeast Virginia. Myself, Dr. Kimberly Hunt, Dr. Nicole Miller, Dr. Diana Reinhart, Dr. Brittany Terry, Dr. Rodney Watson, Dr. Sarah Youssef, and Dr. Joe Lee, probably combined well over 120 years of pediatric experience. We know we've had more cases in our region, including teachers and students. We know this will continue to be the case. It is our opinion that keeping schools closed will cause much more risk to the children of our community and their families than COVID ever will. We think our suggestions are in agreement with the AAP recommendations as well as the recent CDC guidance. Our suggestions are as followed: mandatory masks, cohorting students, utilizing outdoor spaces as much as possible, making clear guidelines for families of what to do if a child is sick, allowing those families that want to return to be able to do so. If not allowing the most high risk to return, those with IEPs, open DCS cases, start with even elementary age kids. Those that are at the lowest risk of spreading COVID and the least likely to benefit from virtual learning. Dr. Robert Redfield from the CDC commented, "It is critically important for our public health to open schools this fall. School closures have disrupted normal ways of life for children and parents, and they have had negative health consequences on our youth. The CDC is prepared to work with K-12 schools to safely reopen while protecting the most vulnerable. We need to do the same." There's been lots of talks about teachers. The bottom line is that we can only mitigate risks. There are no zero risk scenarios in this situation. Schools are vital for our children, and thus teachers are essential workers, like doctors, nurses, grocery store workers. While they are essential, we can do our best to protect them. The school system can provide PPE, revamp sick policies, tailor jobs by risk. Teachers that are deemed high risk should be allowed to teach virtually. There are no zero risk scenarios. While face-to-face learning is low risk for students and moderate risk to some teachers, virtual learning, while low risk to teachers, is high risk to students. Why even bother opening schools? We believe that the collateral damage from school closures will be much more devastating for children and their families than COVID will ever be. School's primary function is for education. We know that virtual learning is much more inferior when compared to face-to-face instruction. This will be especially true for students whose parents can't, due to work or other issues, or won't be involved in their education. In addition, there are students with IEPs that desperately need services in person. Denying kids this will only widen educational gaps. School is also paramount as a safety net for food, shelter, and supervision. School is the only safe place for some children. We know children not being in school increases their risk of being abused or neglected. This is even more likely given the stress families are under during this pandemic. Schools are a major source of DCS referrals. As pediatricians, we rely on schools to help us keep an eye on at-risk kids. With schools closed, countless numbers of children will fall through the cracks. I know in the state of Tennessee alone that child abuse reports are down 27%. Sadly, this is not good news for kids. We know child abuse has not gone down. I just found out tonight that Sullivan County has the highest rate of child abuse in the state of Tennessee. We can't let these kids fall through the cracks. This is an financial impact for families that don't have other means of childcare. And I'll end with this. School is critical for social emotional learning. Studies in China have already documented increased depression and anxiety symptoms of children where schools have closed. As pediatricians, we're seeing it every day, all day long, increase in amount of depression and anxiety from kids ranging 5, 6 years old to teenagers. One of the problems we're seeing is that we know that this is going to get worse, but we've already have a lack of mental health care in our community. With some mental health facilities closing for a time, some only doing telehealth, and the uptick in need, this scarcity in mental health services will only get worse. The CDC has already said that more kids will die of suicide than COVID. Please open our schools.
Thank you, Michelle. The next speaker is Ben Castle. If you would give us your name and address as your program.
My name is Ben Castle. I live in the Sullivan Gardens area. I didn't go to college. I didn't have to prepare a speech tonight. I wrote down a few notes as I was sitting up there. You know, I'm just a blue-collar worker trying to make ends meet. My fiance is a CNA. She's had to stop work to be able to stay home and take care of the kids. You know, I'm working 2 full-time jobs, 12, 14, 16 hours a day, 7 days a week. You know, yesterday, our oldest child didn't have school. The youngest one had 20 minutes of school. My fiance missed out on a full day's work. I'm doing everything that I can to provide for my family during this time. Try to stay as safe as I can. You know, I work at Eastman driving a dump truck. That's all I've known. That's all I do. I mow yards on the side to make ends meet. It's making a burden on me and my fiance. She's staying home, the burden of taking care of the kids. I don't see her till I come home and go to bed. I'm up before she gets up. She's usually asleep before I am. Just ask you all to please just consider sending our kids back to school. They need it. They're not getting the education that they need at home. My kids they don't pay attention to the computer. When I was growing up, they told us stay away from the screens, don't watch TV too much. Now we're putting our kids in front of a screen for 8 hours a day. Thank you all for your time.
Thank you, Ben. Next speaker is Allison Lee. If you would, as you approach the podium, give us your name and address. Thank you.
My name's Allison Lee. I live at 309 Prophet Lane. I'm just a parent of 2 boys in middle school. I come with 2 concerns. I don't have notes or anything, so I'm just winging this. My oldest son has an IEP. He's struggling. He really is. This whole online thing is just not working for him, and he needs more. He needs more one-on-one instruction. He needs better communication. Which brings me to the second thing. I can't help him through the day. I'm so glad others have brought up mental health stats, because I can't bring stats. I bring experience. I'm a licensed therapist. I have worked with too many teenagers to count in your schools about suicide. I have talked down people off the cliff. Kids, middle schoolers. I'm glad they bring the stats, but again, I talk about suicide way too much in my daily life as what I do. I would hate for it to be a greater impact on this community. Nobody wants to talk to families after the fact. Nobody wants to be that person, I can promise you. And I've seen the effect of that in my job, in my experience. And that is what I bring to you. Thank you for your time.
Thank you, Allison. Next speaker is Jeremy Garant. Maybe I mispronounced it. You can correct me.
I'm used to my name being mispronounced, so I ain't worried about it. I'm sure everybody can hear. Whoa, I need to back away. Sorry, I've spent too much time in the military, so I know how to project my voice. So I'm going to try not to blow everybody's eardrums out. I didn't come with a speech. My name's Jeremy Garant. I live at 481 Canton Road. I come here as a parent. I did not come here for any other organization or anything like that. I didn't come with a speech. I wrote some notes down that I just wanted to make some points. on how hurdles have been trying to do this online training. I work in law enforcement, so I'm essential. I have had to work the whole time since I've been here. I drive over an hour to work every day. So then I turn around, have to do work, come home, and catch up my little one in whatever class he was unable to do due to not being able to sign on. The sitter that's watching him couldn't find his password, or couldn't get onto the computer, or didn't know what the schedule was because it's all laid out confusing. So then I turn around and have to then try to teach my son, educate him, participate in the classes with him for anywhere from 2 to 5 hours after I get home from work. Then have to try to turn in his paperwork, which is also turnaround confusing, on how we're supposed to show that they are doing this, and they are attending, if they're not able to do it during the day when the teacher's actually instructing. The first day, actually not the first day because it was Monday, the second day technically. The first day ended up being orientation. I'll get into that one in a minute. First day, Monday, of course, had problems logging on. So here we are trying to do it after I get home from work, 6 o'clock. It's after 11 o'clock, I'm messaging the teacher, trying to figure out how are we supposed to turn this work in? How are we supposed to show his work that he's participating in it? There's not really an answer. And I'm not blaming the teachers for it, not one bit, because they're trying to learn these systems also. They only had 1 week. They have no idea how to utilize it. Same thing with then you're expecting the parents and the teachers, or not the teachers, but the parents and the students to then know how to use it also with no directions. To me, it seems like the logistics of this whole platform was not thought out. The whole thing of it. I have done a little bit of research on the program that y'all are using. What is it, Carver? Something like that? That's the program that I think that we're using. There's other states that are utilizing that. They have a little thing on there where parents can log in. It's not available here. Don't know why. For us to be able to track stuff like that. Socialization, that orientation that we had on that first day, that should prove to people that kids, especially younger kids, need that socialization. The orientation was 30 minutes long. Anybody want to guess how long the video was? It was over 2 hours long, and that was just the kids sitting there playing with each other. That's proof. They need that socialization. They haven't seen each other all summer. They were catching up, showing each other toys. I sat down and watched the whole video afterwards when I got home from work the next day. Another thing is reach out, look at other states, other school systems. What are they doing? I have one little one here in Sullivan County. I have 2 other kids in another state. They chose their own choice. One's going to online, one's going to school, and they did that, gave the parents the choice, so that way they could social distance. That's all. I'm going to conclude it now.
Thank you. The next speaker is Ashley Todd.
Ashley Todd, 628 Rock Springs Drive, Kingsport. Since watching the school board last week, I was compelled to express my disappointment in the decision made to participate in a hybrid model. I hold a master's degree in education, and I'm a former middle school English teacher. My family moved from Florida 2 years ago to be part of a smaller, more family-oriented community, and Sullivan County has been just that. I felt welcomed and like my voice is heard. Last week's school board meeting was incredibly disappointing, with the survey expressing that nearly 50% of parents desired their children to attend in person, and it was decided that we would go hybrid. Why is it that we cannot return to school when that is what the majority of our parents want? I am currently not teaching due to our move, but I am a working mom of 4. I have 3 school-age children in grades 4, 2nd, and kindergarten, and I can empathize with teachers struggling to prepare for the current situation. However, it was mentioned several times during the discussion that teachers need more time to prepare for children coming back to school, yet parents were expecting and planning for their children to return August 17th. We are not able to plan. We are given little time to prepare for the continuous changes. With 2 working parents in our home, we are sending our youngest to daycare. She's almost 2, and it's costing us close to $500 a month. And I have been fortunate to have access to the YMCA Emergency Child Care. Currently, there are over 130 students enrolled in this program. In fact, it was at capacity when I attempted to register. But since I began working for the Y, they were able to accommodate my little ones. Unfortunately, this free program is coming to an end, and we are going to be forced to pay approximately $100 per week per child. Between this and daycare, our expenses for childcare will rise to nearly $1,400 a month. It's more than some people's mortgages, and it causes a large strain on our family. Also, the lack of consistency is mind-boggling. There's so many participants in these facilities and programs. I know my family is not alone in this situation. Private schools here are open, or they're opening soon, and schools in Jacksonville, Florida, where I'm from, are reopening. As Mr. Hughes mentioned last week, families are going shopping, eating out, attending gymnastics, dance, etc. People are going to amusement parks and water parks. There's absolutely no reason our schools should remain closed. Our children need to be in school. This is detrimental to their health and a major strain on parents financially and in so many other aspects. It is pointless for schools to be virtual if they're going to go to another school-like paid setting surrounded by other children and teachers that are not actually teachers. Yesterday, as my 7-year-old walked into the YMCA ECC, she carried her backpack filled with books, a pencil box, computer, hand sanitizer, folder, and so much more. She had her lunchbox and a giant bottle of water, since water fountains are closed. Just walking in, she fell and scraped her face on the cement. She is not able to leave anything in her desk or establish a safe spot for learning. She and so many others are having to haul these supplies to and from varying places daily. This is not good for them. I'm begging you to reconsider your decision for a hybrid model of returning to school and asking you listen to our parents and our children's needs to reopen school. You were voted to speak for us. You were voted to advocate. And that's what I'm asking you to do. Let me close with my son's letter he wanted me to read for you. He's in 4th grade, and he said, "Dear school board, I want to go to school because I want to see what it looks like. I'm a new one. I want to make friends and have fun and do fun work. I want my sisters to have fun too. Hopefully you let us in." From Preston Todd. Thank you.
Thank you, Ashley. Next speaker, Harry Hart.
Harry Hart, 208 Timberland Circle in Kingsport. Good evening. I want to share some figures with you. Less than 5% less than 3%, 0.9%, and 0.0011%. These are all guidelines for 14-day revolving percentages for new positive COVID tests for full opening of schools for the states of New York, the city of New York, the state of Pennsylvania, and the last one of 0.0011% for Sullivan County. Now, based upon the total population of Sullivan County in 2019 of 158,348 people, that translates into a little more than 8 positive COVID tests over a rolling 14-day period in the entire county. Some other important statistics. According to the CDC figures I was able to access online, less than 0.02% of COVID-19 deaths are among children under 14. They did not separate how many of these had pre-existing conditions. From the same source, for people under 60, that death rates are less than or equal to those from seasonal flu. Why are we running? One other figure I'd like to share. According to the latest research done by the Federal Reserve Bank that I was able to locate, 34% of households in Sullivan County, Tennessee are single-parent households. 34%, 1/3. And these are the people outside of the students that are most being impacted by the decision of the school board to keep the schools closed. The burden of education of our children is being transferred from the professionals to those who are trying to provide food, shelter, and emotional support, among other things, to their children. And they are definitely not trained or educated in this area of educating the children. I want to conclude my remarks with a quote from the Tennessee Department of Education Commissioner Penny Schwen. Time lost in the classroom also has implications on overall well-being, especially for at-risk and vulnerable student populations. Thank you.
Thank you, Mr. Hart. Our next speaker is Jeremy McLaughlin.
Good evening. My name is Jeremy McLaughlin, and I live in room 507, Sullivan Central High School here. I teach physics for you, and for the epidemiology hobbyists who have been deferring to and grateful for your teachers this evening, grab your notebook. Class is in session. Like I said, I teach physics here at Central, and tonight I'd like to speak to you not as the past president of the county's largest professional organization or on the explicit behalf of any of my teacher friends, but merely as a scientist, an observer of the world. As a science teacher, there are few things that I like better than a rubric, a way to grade a project. Fortunately for me, you've all published that rubric, the framework for a safe reopening of schools, and that's available on the county website. In that rubric, written by several of my friends who are in this room, you, the board, adopted a way to grade the health of this county and the ability to safely allow students back in our buildings. While it is, of course, impolite to discuss grades in front of your peers, y'all, I'd like you to stick around after class. We need to talk. I don't have all the numbers, but I know that I have students who are sick with the virus. I have colleagues who are sick with the virus. My colleagues have family members who are sick with the virus. Our community is sick of and sick with the virus. By the measures you adopted, it is unsafe to bring our students back into the building. But that doesn't mean that learning has stopped. Quite the contrary. While there are struggles every day with technology, our students and teachers are rising to meet the challenge of these challenging times. Ask one of your teachers how it's going in their digital classroom. We all know that it's not as good as if we had smiling faces in front of us in our rooms, but every teacher here knows that having our students here with us right now is simply not safe. The ship you command is enormous, and changing direction takes considerable time and energy. The online course you have charted is working. It's not ideal. We know that we have food access issues, and childcare issues, and mental health issues, and digital access issues. How can we have a Google Meet for a kindergartner who doesn't know what the letter G looks like? This is not an ideal scenario, but if you would like an even worse scenario, bring the students back to school. When the students get sick, and they will get sick, who will they bring the virus home to? If a student is quarantined, that's awful, but what happens when a teacher gets quarantined? Do you have the substitutes to watch the kids who have returned to the building? Will these subs be able to log into Google Meet and teach the kids who are still remote? How do you feed the kids in your building when cafeteria staff have been quarantined? That's not a hypothetical, that's actually happening right now. The numbers are clear. Schools that are reopening are seeing explosive growth in cases in children. We will be no different from those schools, and will be worse off because we ignored their warnings. I live in Abingdon, and tonight my school board voted unanimously to have students attend classes online for the first 6 weeks of this school year. Do we have some secret sauce that they don't have? My wife works for Washington County, Virginia schools, and while she's certainly smarter than me, they as a whole can't be smarter than us. So why are we wasting time leaving children, parents, and teachers in limbo, unsure of their plans for the end of the 9 weeks, let alone their plans for the end of the month? Fix this uncertainty tonight. I understand that consensus is hard to build. Your reopening plan, the signs on the door, health experts, even the county mayor says to wear a mask, and it appears that you can't reach a consensus on that. Your staff have reached a consensus. We can't keep your kids from getting lice. How can we keep them from getting the virus? We cannot keep students safe in our classrooms right now. Mr. Spivey, you made the comment the other evening that we are acting in loco parentis, in place of the parents. Parents, I have trained your students with fire drills, tornado drills, active shooter drills, but this is not a drill. This is an emergency, parents, and as much as I would love to see my students, your children, they're simply not safe. I encourage each of you to vote tonight to allow your teachers and staff to continue to work online while our numbers of cases increase in this county. It's not an easy one, but this is quite literally a life or death decision. Those of you who know me know that my wife and I have lost both of our sons. Burying a child is not something I wish on my worst enemy. The hypothetical fear that you all have, that 0.001%, I have faced and I have lost. Here tonight, you have the opportunity to keep thousands of students safe. Not perfectly safe, but safer. And perhaps in some small way you can help avert a tragedy. It will require hard work and long hours, but I know that our students are up to the challenge, and I think your teachers are too. Thank you.
Thank you, Jeremy. The next speaker is Timothy Dale.
Hello? Is that loud? Everybody can hear me? All right. My name is Timothy Dale. My address is 1646 Crescent Drive, Kingsport, Tennessee, and I'm representing, I guess, the teachers. I watched the board meeting last week, and I noticed that several of you commented that as the board meeting was going on, your phones was lighting up, texts, emails. I'm the president of the Sullivan County Education Association. I represent the teachers of Sullivan County. My electronic devices were lighting up, and I'm just the voice of the teachers. I'm just going to say some of the questions or comments that I received while I was watching the BOE meeting, and within the next day or two. And I don't even think you'll have to flip me to yellow. I'll be able to go through pretty quick. First of all the teachers were impressed that talked to me that you guys stayed engaged at that meeting to the 3-hour and 30-minute mark. They appreciated that because they know that you guys are concerned about these issues. You're involved. You want to make the best choice for everybody. They also noticed that the central office staff had pulled another 12-hour day and were there with you trying to help Johnny on the spot with facts. But These are some of the questions they wanted me to ask you, or some of the points. First of all, they wanted to know why we were going to begin to deviate from what they thought was a great plan. It's a good plan. That's just a question they had for me. The survey. Great that you guys let us take the survey, teachers, family, staff, and administration. But the consensus was we were missing a third answer to the one question. Follow the plan, stay virtual till the numbers go down. That's just a question that the teachers had. Number 5, the talk of the pediatricians and the things about children not having the symptoms as bad and all that, that's true. But we've also heard that children from the age 10 and above can transmit the disease as good as adults. We have a lot of 10 and above in our schools. The question is, if they're asymptomatic or slightly with the symptoms, they'll spread that. They go home. And about 30% of our kids probably live with grandma or grandpa and grandpa lives in their house. Those are folks that already have one of the signs of being susceptible. They're elderly. 6, the Journal of American Medical Association released statistics 2 weeks ago that said, by closing schools for one 30-day period in the spring, we probably have averted 1.4 million cases and up to 40,000 deaths. That's a large sum of money across the country of the United States. You guys all talked about cleaning supplies and having the school cleaned. I don't think it'll be a surprise to you guys that you'll know cleaning in schools is hard. We have a limited staff. Sometimes cleaning can be spotty. I had teachers tell me that other than the trash, their room hasn't been cleaned. It's not the janitorial staff's fault. We don't have much staff and supplies, and I understand we're not going to get more staff or supplies. So teachers have a concern about keeping a clean school. They want to know about when the PPE supplies will be brought. And we always hear the great story of teachers out of their own money. They'll buy food supplies for the kids and stuff. Now teachers are probably going to have to bring their own cleaning supplies. We talked about a teacher at the BOE meeting who left because of the virtual learning. I talked to another teacher who left the system, or teaching, because she didn't want to do virtual learning, but she also agreed that that was the safest thing that we could do right now, until the numbers came down. Finally, mask mandate. It should be uniform. Teachers are wondering why there's some people in their schools not wearing masks. Thank you.
Next speaker, Brent Toole.
Brent Toole, 244 South Hollow Road, Blumpville, also PE teacher at East Middle School, and I have 2 sons in the system as well. I have a couple statements before I ask a multitude of questions here this evening for the panel gathered. Over the last several weeks, even tonight, I've seen how people have expressed themselves on being back in person learning while in a pandemic. With one of these reasons this is labeled a pandemic is because of the unknown long-term effects of COVID-19. We all look at current data. We've talked about data tonight. However, the data will change before we leave this meeting tonight. Every one of us in this room knows that we can spend the data and the numbers how we want to spend them for whatever side we want to be on. I have several questions about our reopening plan and protocols that we have in place. What is our reopening plan? Is it the matrix that we have now that we've not followed? Or are we going to come up with a new matrix and put in that place so we know what to do when we get sick with staff, students, and teachers? What is Ballot Health's capacity for the region? Maybe we need to speak with Ballot Health and see what their capacity is. We don't know what it is. They have a press conference, but it changes daily as well. And everybody in the area is using our matrix that was developed in Sullivan County. The cities, Johnson County, Carter County, everyone's using our matrix. If we make a decision tonight not to continue to use our matrix and use a different matrix, we need to put one out there. Because if we don't, then we all go back to school at the same time. Does Ballot have the capacity to handle that? sports. There will be games played, but there won't be a whole season played. We've already seen that. I coach basketball at East Middle. We want to play basketball this year, but we don't want false hope. We don't want to start again, and I'm afraid we're giving kids false hope, thus more mental challenges with false hope. If we get put on a 14-day self-isolation plan as a teacher, can we work from home? What if we are so sick we can't work from home? The CARES Act has not been communicated to us from the HR department. What is the CARES Act? Can we get copies of that, please? What are current employees doing right now that's already faced this situation at a multitude of schools? If an employee has a doctor's note for another illness and we're teaching from home or teaching from school, can they work from home? We've had that situation occur already that I'm aware of, and that person could not come into the building, and we've had another teacher teaching 2 classes each day. If an employee is sick and they have to go out 2 different times, what is that employee going to do? We're going to burn through all our sick days to try to teach for 1 year? The reason I ask this, we're not going to be able to locate substitutes who are willing to come in as we are now essential workers. The environment or even access our materials. Cleaning. I've not seen any differences in our cleaning practices at the buildings. What's our cleaning protocols for each building? Are we going to have someone continually wiping down surfaces once kids come back? We would need a to-do list for each one of those areas that would be strictly followed. Do we have adequate personnel to clean the building? Do we have proper supplies to clean with? I have personally already used a substantial amount of cleaning supplies. I got online last week and was going to buy $200 worth of cleaning supplies more, but I couldn't get them purchased. They were sold out. Why don't we have hand sanitizing stations throughout the buildings? I don't see anything. Have we looked into cleaning practices that some local restaurants and universities are using? It's called the program, it's called BioPure. Who is responsible for cleaning the buses after each run? What do those procedures look like? Social distance. We don't have any dividers for anyone at this time. We have no markings on the floor for flow lanes at this time. We could have purchased materials divided the hallways as far as plexiglass or Lexan. What does our physical education classes look like going forward? Our virtual learning academy is full, but we probably need to try to get more people enrolled quickly. Our teachers are working, we are working even harder than ever. I just hope that we can define a plan so we can move forward to reach a common goal to get everybody back in the building, but I don't think it's safe at this time. Thank you.
Thank you very much. It looks as though we've been through the list of requests for comment that I have on this topic. Is there anyone that I've missed? Then I do have a Reed Osborne that wants to speak on another topic. You have the floor.
Good evening. My name is Reed Osborne. I live at 319 Chesterfield Drive in Kingsport. I represent the Booster Club at Westridge High School. I don't want to talk about the high school. In a meeting held at Colonial Heights Middle School by the former director of schools, at the very beginning of the process of building this new school, words like mega school and only the best of the best were used to describe this school. In that meeting, the question was asked, are we going to install turf on the field at the school? In the early beginnings of January, when the Booster Club was being formed, that very question was asked again, and we were told all options would be looked at. Now we find out from the last Friday's meeting, the contractor needs to know which direction to go, turf or grass. But this board has not solicited an actual bid for that turf. In that meeting, a number of $1.6 million was used for the turf at the new school and east. But as Dr. Cox stated, the purchase of turf would need a true bid, and that could take 4 to 6 weeks. So my question is why? Why has this board waited to the point of go, no-go with turf before you even start talking about this issue. This lack of preparedness looks like from the outside like you have never considered turf and have waited to the last minute to force your hands with this decision. As for the cost of turf, in that Friday meeting it was stated that you do not have the money for that turf, but the chairman said he had some ideas. Mr. Chairman, as I understand, this board has a current fund balance of over $21 million. And of that, $10 million is undesignated for the board to use where it deems necessary. The money is there. The installation of turf will not only benefit the football team, but it will also benefit the other sports as well. An example would be the baseball team. If the field's rained out, they can go to the field and practice. Other uses could be community events without the fear of damaging the playing surface, like what happened at South at graduation, at the cost of repair of almost $3,000. Maintaining the grass field takes a lot of time and effort by our coaches and volunteers to keep that surface looking good. The money for this is not given to the program and must be raised each year, and that cost can exceed $10,000 a year. The cost of maintaining a turf field, $2,500. In closing, I have one thing to ask of this board, and that is give the citizens, and more importantly, the students of Sullivan County, the best possible facilities that you can, and we're promised. Thank you for your time, and go Wolves.
Thank you very much. Dr. Cox, that's all the public comments I have. If you want to continue with the agenda.
Thank you, Mr. Hughes. Continuing with the agenda, we come to communications of the Board of the Directors report. We shared a lot of information during the work session, and I'd just like to take this opportunity to say a big thank you to all of our staff who continue to work very hard with the reopening of our schools. So at this time, I would just conclude the director's report, having completed the report during the work session. Okay. Mr. Hughes has asked that we take a 10-minute break, and then we'll be right back.